Hello, my name is Irene Shao, and I'm the Homeless System Training Coordinator for King County Regional Homelessness Authority. This video recording is for homeless service providers who are working with clients. It will explain the required documentation needed for a client who is chronically homeless. First, we will start with the definition of chronic homelessness. The definition of chronic homelessness is a homeless individual or client with a disability. The client must have a disability and they must be the head of their household, based on Section 4019 of the McKinney-Vento Assistance Act. Who lives in a place not meant for human habitation, a safe haven, or in an emergency shelter, and has been homeless and living as described for at least 12 months. Or, and it's important to note that this is an or, on at least 4 separate occasions in the last 3 years, as long as the combined occasions equal at least 12 months, and each break in homelessness separating the occasions included at least 7 consecutive nights of not living as described. Keep in mind here, a break in homelessness is considered to be 7 or more nights. In addition, an individual or client who has been residing in an institutional care facility for less, including jail, substance abuse, or mental health treatment facility, hospital, or other similar facility for fewer than 90 days and met all of the criteria of this definition before entering that facility. And keep in mind that the individual or client residing in an institutional care facility does not constitute a break in homelessness. Or a family with an adult head of household, or if there is no adult in the family, a minor head of household who meets all of the criteria of this definition, including a family whose composition has fluctuated while the head of household has been homeless. Furthermore, besides understanding that a break in homelessness is 7 or more consecutive nights, couch surfing is considered to be a break if it's 7 or more days in a row. A break can also mean an individual residing in an institutional care facility constitutes a break in homelessness if the stay is 90 days or longer. Note that an institutional care facility includes a jail, substance use or mental health treatment facility, hospital, or other similar facility. Here is the first example of chronic homelessness. A client with a disability said that she has been living in a car near the Green River in Kent for 14 months. This is an example of a client who has been living as described and has been homeless for at least 12 months. Here is another example of chronic homelessness. This is an example of chronic homelessness on at least 4 separate occasions in the last 3 years, as long as the combined occasions equal at least 12 months, and each break in homelessness separating the occasions included at least 7 consecutive nights of not living as described. A client with a disability said he had been living on the streets of downtown Seattle from April 2023 until April 2026. In January 2024, he stayed at a friend's house for 7 nights. In October 2025, he went to jail for 91 days. The client also lived with a relative for 2 weeks in February 2026. There are several key points about chronic homelessness that I will highlight here. The first one is disability and required length of time. The main difference between chronic homelessness and literal homelessness is that you, as in the head of household or the client, must have a disability and the required length of time to qualify for chronic homelessness. In addition, this is how disability is defined. A homeless individual with a disability is an individual or client who is homeless and has a disability based on Section 103 of the McKinney-Vento Homeless Assistance Act, which is one or more of the following: physical, mental, emotional impairment, which includes impairments caused by alcohol or drug abuse, post-traumatic stress disorder, or brain injury that is expected to be long continuing or of indefinite duration, and substantially impedes the individual's ability to live independently, and can be improved by the provision of more suitable housing conditions. Or the client has a developmental disability as defined in Section 102 of the Developmental Disabilities Assistance and Bill of Rights Act of 2000, or the client has HIV or AIDS, which is the disease of acquired immunodeficiency syndrome, or any condition arising from the etiologic agency for acquired immunodeficiency syndrome. Here is how the evidence of chronic homelessness status is collected. There are 2 types: third-party documentation and intake worker observation. Third-party documentation includes the following: HMIS records or similar database records, an individual record of stay at an emergency shelter, safe haven, or from a street outreach contact, or a written observation from an outreach worker of encounters with the individual or head of household that includes a description of the conditions where the individual or head of household was living or is currently living. This is an example of documentation from an outreach worker. Notice the information highlighted in yellow. These are the critical pieces of information that should be included in the letter. First of all, the letter should be on the organization's letterhead. It should be addressed to the name of the program the client is applying to. Then the outreach worker should state their name. In this case, her name is Jane Doe. Her title in this case is caseworker, and the organization she works for, which in this case is ABC organization. Then you will need to write the client's name and the dates of homelessness. If you look at the second paragraph, this is what it says. Our team has been working with Jenny Smith, that's the name of the client, since December 1st of 2023, which is the date, and can verify that she has been continuously homeless since December 1st, 2023, without a break in homelessness. You will also need to write the client's location and a description of the list of services they have received. This is the third paragraph here. During this time, Jenny Smith, the client's name, has been sleeping at XYZ shelter in downtown Seattle. This is the location and description, and has been receiving employment and housing navigation services, which is the list of services, from our agency. If you have any questions, please contact me at 100-123-4567. And that is the contact information that must be left there and written in the letter. Lastly, the outreach worker, Jane Doe in this case, has to sign the letter and also print her name, as well as provide the date, May 18th, 2026. Here is an example of a written observation from a community member that has physically observed where the person or household was or is currently living. And a written referral by another housing or service provider must also be included. Here is an example of a written observation from a community member. The community member will need to state their name, the client's name, the exact dates or time frame that they observed the client, and the location where the client has been residing. In this case, the community member's name is Bob Doe. The client's name is James Smith. The date physically observed was February 17th, 2024 to February 17th, 2025. Keep in mind, use exact dates or time frames. And the location observed where the client has been residing was near the Burien Library, 400 Southwest, 152nd Street, Suite 100 in Burien, Washington. Here is how to verify a client's homelessness status using an intake worker's observation. The written observation by the intake workers encounters with the individual or household must include a description of living conditions. Note that an intake worker's only encounter with an individual is when the individual is seeking assistance. Then this is counted as second order of priority and will not count towards the minimum 9 months required for third-party documentation. The observation must be signed by the individual or client or head of household, and the intake worker must still document the living situation of the individual or head of household seeking assistance. And The intake worker must document all steps taken to higher order of priority evidence, and for self-certification, this must be written by the individual head of household or client who is seeking assistance. Here is an example of John Doe's self-certification. He filled out with an X in yellow that he has lived in a place not meant for human habitation. This is in the left column under living situation. In the right column, he wrote, explaining his location and dates. I stayed in a car for 5 months near the Green River in Kent. I lived there from January 2025 to May 2025. During that time, I did not tell anyone about my situation. John Doe also stayed in an emergency shelter. In the left column under living situation, he filled out the emergency shelter part with an X in yellow. He also explained it in the right column with, I stayed at XYZ shelter from June 2025 to December 2025. John Doe also signed and dated the self-certification. A staff supplement to self-declaration of homelessness looks like this. The top part says that the third-party verification is the preferred method of certifying homelessness. And then it says, I understand the self-declaration is only permitted when I have attempted to but cannot obtain third-party verification. Here is an example of the documentation of attempts made for third-party verification, the date of contact, the individual organization contacted, the method of contact, and outcome all need to be filled out for this. In this case, the date of contact was February 1st, 2026. Susie Smith was contacted as the individual contacted, who is a case manager at XYZ shelter. The method of contact was they were called and emailed, and the outcome was that they did not return any of the calls or emails. Providers should also be aware of the self-certification rules by project. 100% of all households served by a recipient can use self-certification to document periods of homelessness of up to 3 of the 12 months of homelessness. However, record-keeping requirements provide that up to 25% of all households served by a recipient can use self-certification as documentation for the full period of homelessness in the rare instances where persons who have been unsheltered and out of contact for long periods of time. Attempts to obtain third-party documentation and the reason that documentation was not obtained must be documented. At least 75% of households served in an operating year must have third-party documentation for 9 of 12 months of homelessness, and self-certification may be used for the remaining months. Here are some common mistakes that providers make when they are collecting the proper documentation for clients who are chronically homeless. Exact dates and time frames. Not using the exact dates and times with the month and the year. Having a missing date on a letter is a common mistake, as well as not having certain staff signatures. If the homelessness is episodic, not doing the following, providing enough episodes, detailing the 12 months, explaining the breaks clearly, are common mistakes. And lastly, disability verification. Not having the correct individual sign off. For example, they are not licensed to diagnose or treat the condition they are verifying. And here are the sources used to produce this video recording. Thank you.